we're doing dental examination, obviously you need the dental record and chart. So just to see what teeth are like shite, basically. So this is the document required for certification, treatment, sale of the horse, of course, litigation. And it uses anatomical terminology. So of course I mentioned the maxilla, so the upper jaw is called 100 and 200, things like that. And use different symbols as well. It's like a whole thing. And yeah, you can use diagnostic imaging. So there's X-rays, CT, MRI, nuclear medicine, ultrasound and endoscopy of the maxillary sinuses. So we obviously know what an X-ray machine looks like, Roy Dev. So anyway, sometimes X-rays are very hard to interpret. You need the perfect positioning, obviously. You need intraoral and extraoral views. So I imagine you do an X-ray inside the mouth, because I've done it before. You like bite down on one of those X-ray discs, and on the outside they probably will have the horse standing next to like an X-ray disc away from them. And yeah, a suitable method is for the reserve crown and root disease. X-rays are a suitable method, for reserve crown, root diseases, and periapical abscesses. I feel like that could come up. And you have classifications of dental diseases. So for the incisor teeth, you have brachygnathism. So this is parrot mouth. I think it's in the next slide. Yep. You also have prognathism, which is sow mouth, so underjet. So yeah, so this is sow mouth. Oh, sorry. This is, and then there's camopilognathism. So this is wry nose, like that. Then you have retained deciduous incisors, so that basically means the temporary incisors haven't gone yet. Polyodontic permanent incisors, I'm not sure what that means. Maybe you have more teeth. Fractures of the incisors, incisor occlusal surface abnormalities, so maybe those surfaces of the inside of the teeth I mentioned, there's something wrong with them. There's also pathological incisor diastema or diastemata, and you have generalized incisor overgrowth as well, and they've also written it in Latin for some reason. So yeah, we've mentioned parrot mouth, which is brachygnathism, and I'm saying the words because this is probably going to come up, not this. Prognathism, this is sow mouth, and campylonathism, which is wry nose. And yeah, basically these are inherited defects leading to incorrect wearing of the teeth, difficult food intake, and malocclusion. And you do surgical correction by slowing down the growth of the incisor bone using a metal wire. So they're going to use braces, basically, which is quite funny, imagining a horse with braces. So yeah, so there are retained deciduous incisors. So it doesn't sound too bad, but honestly, like, it kind of looks like this, because imagine the deciduous teeth are much smaller, and you have polydontic permanent incisors as well, and this obviously causes oral discomfort and pain and sometimes dysphagia, so they can't eat. And you can do an extraction of these teeth, and you do it under sedation while the horse is standing to and obviously when you remove the teeth, you have to avoid injury to the adjacent teeth and the underlying permanent incisor, because the whole goal of removing it is to get the permanent incisor to come out. And after you loosen the periodontal fibers, so you use the elevator in the gum and you just kind of loosen it again and again. We use the osteotomy or dental elevator to do that. So there are fractures of the incisors. This is the perfect picture. That is bleak. You have incisor occlusal surface abnormality, so I assume maybe it's like this, for example, and pathological incisor diastema or diastemata. I think maybe it could be this, but that's a total guess. I don't know what it means. And generalized incisor overgrowth, so maybe these incisors might be overgrown. And there's rostral and caudal enamel spikes and enamel hooks. This isn't good because you slowly break down food, you have weight loss, you have food out of the mouth when chewed, and you have behavioral changes. So obviously regular rasping or floating every 6 to 12 months is very good, and you can also cut them with the dental shears or remove with a dental chisel. And yeah, now we have more classifications of canine teeth disorders. So there's disposition, so I imagine they're in the wrong position. Fractures, of course, dental caries. So remember, this is like the black pit we were talking about in small animals, and dental tartar. So this is like the thick brown black stuff, and apical infection. So yeah, we'll go into that. Oh, we won't. Okay, so there are all teeth disorders like fractures and disposition, so they're in the wrong place. And yeah, disorders of wear of the cheek teeth. So this is a big issue. So you have wave mouth, which is where everything's like, no, sorry, I think this is the abnormal surface. And you have step mouth, which I think is maybe this possibly, and smooth mouth. So you have to remove the uneven surfaces with cheek teeth shears, with rasping or floating as it's called, to restore a flat occlusal surface. So even though this is like a wave formation, we want them to be like flat, not sharp, because it can lead to ulceration in the cheeks. So other cheek teeth disorders, so you have retained deciduous cheek teeth, so kind of like the retained incisors, cheek teeth disposition, kind of like the wolf teeth and the canines, pathological diastema, like the incisors, supernumerary cheek teeth, so maybe more cheek teeth, disparity in the length of the cheek teeth rows, and trauma and idiopathic cheek teeth fractures. So yeah, cheek teeth can get fractures, we may not know why. So these are retained deciduous cheek teeth. I assume it's this one, although there's an arrow here. Yeah, okay, let's look at that one. Yeah, it doesn't look good, does it? So you need to do x-rays to evaluate the situation at the tip of the dental roots, basically. With pathological diastema, these are when you get supernumerary cheek teeth, and as you can see, you need to extract it if there are extra teeth, because it causes a pocket accumulation of food, and the reserve crown is rostrally displaced and it protrudes over the gum line, so it's really not only uncomfortable, but it's just not good for eating. These are exuberant cheek teeth, so it leads to so you have traumatic and idiopathic fractures. So you can see a part of this cheek teeth is just missing. You have shear mouth or eruption cysts, so you can see there's a swelling here, I think. So they usually regress over time, so you can leave them, and are not palpable in horses over 5 years old. But I'm sure it's uncomfortable. So we know what rasping is. You remove the sharp surfaces from the inner edges of the lower arcades and outer edges of the upper arcades. Now, there are dental procedures on the field. You can correct shear mouth, wave mouth, so that's the one that's like this, step mouth, so I think this is the one where certain teeth are like that, smooth mouth, slope mouth, a lot of S's here. Exuberant incisors and cheek teeth, rostral and caudal enamel spikes and hooks, and you need to, so this is where you correct the teeth. For extraction, you extract the retained temporary incisors, very important, and highly mobile canine teeth, because if they're mobile, they're very painful. Anyway, retained cheek teeth, so same as incisors, wolf teeth. So yeah, anything incisor, cheek, wolf, canine, and dental tartar, removal is rare. So yeah, we're going to end here. So overall, there are similar or subtle clinical signs. It's only upon observation you can actually diagnose it through dental examination using a mouth gag and a speculum. And obviously you have to do this very carefully and after sedation. A horse isn't just going to chill there while you have your arm in its mouth. And you need to use a wide range of dental tools, know their proper use, like the rasping especially, or a chisel or a probe. We use x-rays a lot. And if there's cancer as well, we need to do a suspected biopsy, like we have to. That wasn't mentioned before. And yeah, treatment isn't easy. It varies a lot. It's not easy. Yeah, that's said there. And it varies a lot, which is also said there, sorry. So in case of extraction, it's safe and secure, especially if you use anesthesia, as well as an everyday, and you use everyday post-operative care, so things like antibiotics, things like that. And I think that's it for mine, and next you'll hear the practical from Thanos' side.